Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy, Azam campus. Today we are going to learn about excretion of drug. So excretion is the last process in which the drug will leave the body. So outcomes of today's lecture, the student will be able to define the term drug excretion. The student will be able to analyze the various channels of drug excretion, and the last, the student will be able to explain various channels of drug excretion. First, definition of excretion or elimination. The process of elimination, that is a removal of drug from the body, is known as drug excretion. That means the drug will be removed from our body. As the drug is treated as foreign material, always body tries to remove it from the body. So we define it as the process of removal or elimination of drug from the body is known as drug elimination. So it's natural phenomenon that every drug, after undergoing biotransmission, that is breakdown, it should be excreted out of the body by one or more methods and routes. And all the drugs administered into the body are excreted out of the body by other than the route of their administration. For example, if the drug is taken by oral route, it will get excreted in urine or fecal matter, etc. It will not be excreted by oral route only. And if the drug is taken by injection route, like intravenous injection, the drug will not get eliminated by injection route. It will be eliminated by any other route or channel, like you from by urine, that is through kidney or through GI tract, etc. So there are only few exceptions in which the drug is eliminated by the same route by which they are get administered. For example, is inhalation routes. The volatile general anesthetics will get administered by inhalation route and also excreted by inhalation route. So these are the few examples of exceptions. So you can see here the animation of absorption.
Ability. We are now at the site of some skin tissue damage. Tissues in the skin are creating prostaglandins, which are causing inflammation. The prostaglandins are sending messages to the nerves in the skin responsible for the sensation of pain. Once the aspirin arrives in the blood supply at the site, it prevents the production of prostaglandins in the tissue, which will reduce the swelling and stop the messages being sent to the nerves that are perceived as pain. Excretion. Any remaining aspirin in the blood will go round and round the blood supply, going back through the liver several times until it is all used up or filtered out of the body.
So this was the process of elimination by urine. The channels of drug excretion. The important channels of drug excretion include the following: kidney, lungs, intestine, skin, saliva and milk, and the last, bile. Kidney. Kidney is the major organ by which majority of drugs are eliminated in urine. So during urine formation, we have three processes. One is passive glomerular filtration, active tubular secretion, and passive diffusion. All these processes may cause the elimination of drug. So some drug may be passively get filtrated, that is called glomerular filtration process. Some drug may be secreted out of the body by active tubular secretion, and some may pass by diffusion into the nephron wall. So by this process or one or more process, the drug may get eliminated. So if the renal function is impaired, then the concentration of drug in the body is increased, because the drug will not get able to eliminate it. So the drug will be in the body for prolonged period, and it may show prolonged drug effect and also cause drug toxicity. And the excretion of acidic and basic drugs depends upon the pH of urine. Thus it is clear that weak acids are quickly excreted in alkaline and weak bases quickly excreted in acidic urine. So if there is a drug poisoning or we want to excrete the drug immediately, we can adjust the pH of the urine and causes the elimination of drug. Next channel is lungs. Lungs are related to excretion of various gaseous inhalants. Examples: volatile general anesthetics like paraldehyde, alcohol, etc. So all these are eliminated by lungs during exhalation. So sometimes the physician may detect the presence of the drug in the body by smell of the breath of the patient. Next in intestines. The purgatives like cascara sagrada and senna are partially excreted in intestine after the desired action on the large intestines. So these are purgatives, means which removes the fecal matter. So it shows action is large intestine, and also majority of drug is eliminated by fecal matter, that is by the intestines. So heavy metals are also excreted by the fecal matter. Next, skin. Minute quantities of drug may be eliminated from the body by skin. Examples like arsenic and lead. So sometimes this arsenic will get deposited into hair follicles, and some drugs may show skin rashes because of the presence of drug onto the skin. Next channel is saliva and milk. So antibiotics are deposited in milk. Also drugs like morphine, thiouracil compounds and sulfonamides are excreted in milk. So there is a chance that if the infant suck the milk and the milk contains these drugs, will enter into the baby's body and may cause harm to the body. So hence a cautionary warning is to be given to the lactating mother so that the babies do not suffer. And the last is bile. So bile is a secretion of the liver. So this bile secretion is synthesized in liver and passes through the duodenum and gets entered into the small intestine. So the opening will be present in the duodenum, and there is a chances that there will be a reabsorption of the drug. Since the drug will get eliminated by the bile, gets into the small intestine, again it gets absorbed into the blood and goes to the liver. This cycle of circulation is called as enterohepatic circulation. So certain drugs like erythromycin, novobiacin are eliminated in the bile and reabsorbed again in the intestine by enterohepatic circulation. You can see here the image in which the liver will secrete the drug. It goes to the bile duct and then into the small intestine. From a small intestine, again it will get reabsorbed in the hepatic portal vein and goes to the liver. This cycle may repeat, and this repetition or circulation of the drug in this cycle is called as enterohepatic circulation. So drug excretion or drug deposition mechanisms have their own limits, up to which they effectively eliminate the drug out of the body and assist in lowering the plasma concentration of the body, so that there will be termination of the effect of the drug. So what we have learned? We have learned that the process of elimination or removal of drug from the body is called as drug elimination. Second, the various channels of drug elimination includes lungs, intestine, saliva, that is bile, sweat, skin, etc. Thank you.